All right, everybody, it's 1 o'clock Eastern Standard Time. We're going to go ahead and get started here. We'll probably have several more agents and brokers jump on over the next couple minutes. That's totally fine. But to honor everyone's time today, we're going to go ahead and get started. Want to take a second and welcome everybody. We're really excited to have you here today. Hope it's been a good day so far. For those that don't know me, my name is Philip Lamar, and I am one of the marketing directors here with American Central Marketing Group. Want to also introduce two good friends of mine and business partners. One is the founder and CEO of ACMG's on the call with us, Mr. Rob Swander, with us today. Also want to introduce everybody to Brenda Sparks, who's one of our sales directors with ACMG. Brenda has joined us today. Like I said, we're really glad to have you here today. We know you're very busy, so we're honored that you take your time out of your busy schedule to join us. For those that aren't familiar with ACMG, I'm seeing some familiar faces on here. I'm also seeing some people that are newer here. But if you don't know, ACMG stands for American Central Marketing Group, and we are proud to be one of the largest FMO in the country. Folks, what we really do, what our passion is, what we specialize in doing is really serving you. That's our whole purpose as a company, is to serve you and help grow your business. And we do that in several different avenues. Number one, as you probably know, we work with all of the top carriers, vendors, and technology platforms in the business, and we help you connect with them. We help you connect with them so they can be offered in your portfolio of services to take care of your clients. Secondly, we also offer the top commission schedule in the business as well. So whether you are an MGA, maybe you're a general agency, a GA, maybe you're a solopreneur and you just operate your own agency, maybe you're a part of a team, maybe you have agents with you, doesn't matter what that is, we have the commission schedule to match your operation. And lastly, we're proud to offer top customer service. So everything from getting you contracted to getting you trained, field support, we offer it all. And we have the privilege of helping thousands of agents across all 50 states. And hopefully by the end of this call today, we're going to be able to help you add value to your portfolio of services. Before I get into the presentation today and introduce you to Mike and Sean with our vendor today, I want to mention a couple things. If you have been in the individual space selling health insurance or ancillary products for any time, doesn't matter if it's been a month or if it's been years, you probably know, and if you don't know, you're going to find out soon, that some of the most tricky benefits that we have to navigate as brokers, as advisors, is specifically maternity and mental health benefits. If you've been selling short-term, tri-term, fixed indemnity, ancillaries, doesn't matter, and you're in the individual space, heck, even into the group space, these are two really difficult benefits to navigate. And the reason is because a lot of carriers don't offer these benefits. A lot of mental health benefits are excluded. A lot of maternity services are excluded. And this is a major issue in today's world for solopreneurs, for trade contractors, realtors, plumbers, electricians, mortgage brokers, small businesses, you name it. These are benefits that they're looking for. They just don't have a solution to the problem. And I'm excited because today's presentation is going to plug that hole for you. It is going to be a solution to that problem for your clients. You don't have to wait any longer. You don't have to search any longer when it comes to excellent, robust maternity and mental health benefits, along with a whole suite of other benefits from telemedicine, discounts. Today's presentation is really going to add a significant amount of value to your portfolio of services. So without further ado, I'm really glad to introduce you to Mike and Sean. They're going to lead the presentation today. Ladies and gentlemen, we are recording this, so please keep your mics muted. Any questions, we welcome all questions. We ask you to be respectful. We ask you to be respectful of other people's questions and other people's businesses. Please don't mention any rude comments. But if you do have a question, put it in the chat box, and we will absolutely answer your question by the end of this presentation. So Mike, Sean, gentlemen, take it away.
Bill, thank you so much for the warm introduction, and I just want to say thank you to everybody that's on this call. My name is Mike Watts, and I'm with OptiMed Health, and we are the third-party administrator that has partnered with Recuro Health on something that is near and dear to my heart, and something that I feel is a great service and add-on that the individual and under 65 marketplace is missing today. Before we hop in, though, I do want to say, again, I can't say enough about American Central Marketing Group. Rob and Brenda and Philip, as well as all the agents that are on the call today, have been very strong partners of OptiMed Health. So again, I know you guys have a lot of options out there, but we truly, really value our partnership with you and your team. So with that said, I'm going to queue up the PowerPoint presentation, and then I'm going to pass it over to Sean Rafferty, who is the product consultant that helped us design and create this offering through Recuro Health. So Sean, I'm going to queue it up right now.
Great. Thanks, Mike. And while Mike's queuing that up real quick, I think Philip did an outstanding job in terms of setting the stage with, everybody on the phone here has, been selling in the individual marketplace for the most part, right? Whether it be 1 month or several years, it doesn't matter. And you've probably seen different products out there may have some benefit or may have no benefit as it pertains to maternity or mental health. And so, this can be a great, supplement to those products that have something, or in certain circumstances, be even the primary solution, for other scenarios where really they are lacking resources altogether. So we're very excited in terms of what we've built here for you all, and in conjunction with Rob and Brenda in terms of picking their brains around what's going to be impactful for you all. Because as Philip kind of teed it up, saying like, we're here to support you all. And so that's.
Hey, Sean, it's Rob real quick. Your mic is coming in kind of gargling. I don't know if you can make some adjustments.
Oh, am I? Okay, gotcha. Let me switch over to get off my computer, and I'll switch over to the mobile phone real quick, and maybe I'll get a little bit better there. So I apologize about that. Give me 1 second here, guys. Mike, you want to take over real quick while I'm doing that?
Absolutely. All right. So while Sean's getting queued up, switching it over, again, real quick, the agenda today is really just to kind of paint the picture, right? So with the importance of the maternity and mental health stats that we're seeing in the marketplace today. Also, to go over reasons why people are having challenges. And I think, honestly, especially with both these areas, the hardest part really is being able to know where to seek coverage and where can you get treatment from. So this is going to help address that as well. Again, OptiMed Health, we are the third-party administrator, so we'll do all the billing, customer service, utilize our enrollment platform as well. And again, we're also an advocate for you as a broker. So if you do have questions or if you need additional resources, by all means, please, I'll put my contact information up at the very end of the presentation. So feel free to reach out to me at any time.
Hey, Mike, I'm back if you want me to jump back in.
Yeah, perfect. It sounds a lot better, by the way.
It does. Thank you, Sean. Sounds great.
Yeah, I'm not in a tin can in a tunnel or anything like that. So, hey, sometimes you got to adapt. So, again, apologize everybody about that. So, hey, what we want to go over here today with everybody is a couple items. First of all, talk about some high-level statistics regarding mental health and maternity to kind of set the stage for us. Address why people are having challenges seeking these types of services, and then talk about the solution, to those challenges. And then Mike will cover the admin piece of it, and then we'll kind of wrap up around what we see as an opportunity for you all and kind of your call of action. So, Mike, next slide, please. So what we have done is we basically have bundled 3 products in one. We have a maternity telehealth, or what I would consider a concierge type service. That's part 1. Part 2 is that we have a behavioral health counseling program. And then last but not least is the Well Card Savings Program. For those of you all have sold NatGen, for example, in the past, they have built this product specifically into some of their products. So they may look kind of familiar to some of you that have sold those in the past. And so basically it's 3 solutions in one program. Okay, this is available in both English and Spanish. When we're talking about the maternity piece, it's a zero consult, $0 copay for the telehealth service for the maternity piece. They're going to have up to 22 free daily classes, from a whole range of different types of experts from infant health. It's available 24/7 and available in 40 plus states. Mike will kind of go over the state availability here a little bit later. And then specifically, when we look at the mental health piece of it, so phase 2, we have unlimited messaging via chat function with that program, as well as, tele consultations. So it's not just the chat function, but also in terms of being able to do a kind of a virtual consultation with somebody. If there is a scenario where someone needs to kind of take it to the next step and need a face-to-face, within this program, we've built up to 5 face-to-face visits with a licensed clinician. And then the last phase of the program, or the well card phase of the program, we have a couple of really, really strong benefits around a dental telemedicine benefit, as well as a pet telemedicine visit or televeterinarian program as well. And then what I call our deductible savers is, you all have seen a lot of these health plan solutions, will have some higher deductibles associated with them. And so anything you can do to kind of help stretch the dollars a little bit farther is a great thing. So that's what we've done with this, is that we have pretty big discounts off of like over 200 medical type procedures, including MRI services, imaging services, laboratory services. And then heaven forbid, if there ever is a scenario where one of your clients is in a situation where they don't necessarily agree with their medical bill from the provider, they have a medical bill advocacy program where they can talk to them to kind of help negotiate on their behalf with that provider system. So again, 3 pieces into one program, and again, extremely robust in terms of what we put together here for you all. All right, Mike, next slide, please. So let's talk about the maternity piece first. But before we get into the solution, let me kind of set the stage a little bit here. So, for an average pregnancy, the typical young lady will have anywhere between 10 and 15 visits, okay, throughout that pregnancy. But let's think about the real world. So in the real world, what if she has to work during her appointment? What if the weather's really bad and she can't get to her OBGYN? What if they don't feel well, which there's probably a great chance, especially in that first trimester? What if some other emergency happens, and they can't get to their appointment, okay? And then let's say they are able to get all their appointments, and they're in there with their physician, and they forget to ask some questions, especially the first pregnancy, right? There's probably always those additional questions you may have or she may have that they forget to ask. And so what are you going to do in that situation when you can't necessarily go right back into that OB? And then when you're actually in the OB, there may be situations where you kind of feel rushed in terms of, boy, I only have 5-10 minutes, and it's not enough time. So these, I think, are really real types of scenarios and issues and challenges that happen, especially in that first pregnancy. All right, Mike, next slide, please. So if you think about it, wouldn't it be nice, if you had a concierge, to help supplement your OB, okay? So we're not necessarily saying this is going to replace that OBGYN, but it will be a great additional concierge type program to be able to have, who is an expert, who is able to talk to you in the convenience of your own home. So you don't necessarily have to get on a car or a bus or whatever to be able to get to that physician. You can do it, on your convenience, depending on what your schedule is. And then what if you have other family members who also want to maybe ask some questions and they're not able to make that appointment? So this would be a great way to kind of have your family members there too, to be able to talk to, the concierge around, the pregnancy. Okay, Mike, next slide, please. And so that's what Baby Life Advice is a concierge program that allows, the mother and, the rest of the family to be able to, talk to a licensed practitioner, around the pregnancy. You have a couple visits you're allowed, on a monthly basis. And then they have up to 22 classes on a daily basis around a whole range of topics as it pertains to both prenatal and postnatal care, along with the actual the course of the pregnancy as well. So there is an incredible amount of resources available as a part of this maternity and counseling benefit. So especially as I'm thinking about, a first-time mother, this is a tremendous resource, and not limited just to them, but definitely I would think for someone in that type of situation, this would be an incredible resource for them. So that is the first piece of our program, is this maternity and counseling benefit. Mike, do you want to go to the next slide, please? So the next phase is around, the mental health piece. And I think you all would probably agree, you can't flip on the news almost on a daily basis, unfortunately, and see that there are some type of mental health issues going on in the world. And it's just becoming more and more prevalent, these days. And it's just unfortunate, but that's just the reality we're in these days. And as we're coming off of, what I was just talking about, pregnancy, if you think about from a pregnancy standpoint, 1 in 8 pregnant women are depressed. And you all may be very familiar, but postpartum depression is very common. But even during the pregnancy itself, half of the ladies out there are not being treated during their pregnancy, which is obviously something that should be very important. And the diagnosis of pregnancy itself has increased 7 times in 2015 compared to 2000. And here we are in 2023. It's probably even greater now than it was in 2015. Okay, Mike, next slide, please. So if you think about it, you take it even a broader look at it beyond just the pregnancy component of it, there's 58 million Americans that have some type of mental health challenges out there these days, and not even half of them are even receiving treatment at all. And unfortunately, younger adults, are less likely to pursue treatment compared to maybe older adults. And so it's obviously a very, very big problem out there these days. And if you look at the very first bullet point, so even if there was, someone that wants to address the situation, nearly a third of the country live outside of adequate resources to be able to, get, the help that they may need. Okay. And then again, the last bullet, I think also is very important, because a therapy visit can cost up to $250, which actually is quite a bit of money, right? The average is a little over $100. And so it's not inexpensive to get, good quality mental health treatment if you do try and pursue it at all. All right, Mike, next slide, please. So what are some of the reasons why people don't pursue, mental health services? Well, I kind of talked about a couple of them already. One is financial. I just kind of going over the numbers there. 2 is the lack of resources. I just kind of shared with you all, a third of the country doesn't have adequate resources, based on where they live. The third key reason is people just may not be aware of what resources are out there and be able to access. Okay. And then last but not least, for some folks out there, there's kind of a stigma about feeling like they have to go and see someone, or feeling like they need to talk to someone out there. So there's kind of that component to it as well, especially if they have to physically go somewhere. So that leads us to the second part of our 3-phased solution here for you all, and that's the mental health component of it. So we have within our program over 30,000 providers on a national basis. So to be able to access resources is not an issue at all. So if you're that third of the country, especially that has a hard time accessing resources, not an issue here with us. You'll be able to access a resource. We have both English and Spanish speaking counselors. So you'll be able to help out, a wide range of folks there, depending on what their predominant language is. I kind of referenced it, I think, before in the very, very beginning, that if necessary, if there is a face-to-face situation that's needed, we have budgeted for up to 5 visits that can be scheduled. And then it's available on a 24/7 basis. And if you think about it, there are a wide range of reasons why people could have mental health issues. It could be anxiety. A lot of people probably think of depression, but also could be just general financial issues. People are struggling financially and they're having a hard time with money management. This could be a good resource. They could be having some marital issues. So it's just not just, depression necessarily. There's a wide range of issues that can be addressed by using this particular program. Okay, so that's the second piece of it. And the third component of it is the Well Card program. All right, Mike, next slide, please. So the Well Card program has a tremendous amount of resources available within it. So first and foremost, we have a couple additional telehealth solutions. First of all, you have a 24/7 teledentist program. It's a very inexpensive $49 consult, for someone, but think about it, most dentists work, 9 to 5. So what happens if you get a toothache at 9 at night? What are you going to do? You're going to go to the ER? It's a lot easier if you can just do a teledentist and be able to talk to an expert, in the convenience of your own home. Same thing from a veterinarian standpoint. What if your dog or cat, eats something or gets into something in the middle of the night? That vet's not open until 8 o'clock or 9 o'clock the next morning. This is a way for you to be able to access, or for your clients to be able to access, 24/7, a veterinarian to be able to help you with that particular situation. And then from a discount standpoint, we have tremendous discounts off of, first of all, prescriptions, right? I'm sure a lot of the health products you guys have a prescription component to it. They may even have a copay to it, but this can kind of work think of it like a GoodRx. I've even researched some of the drugs already on this program, and they're even better value than the GoodRx program. So this is going to be a tremendous savings for your clients on their prescription services, as well as discounts off of hearing and vision, as well as vitamin programs as well. And then last but not least, in regards to the healthcare itself, there is tremendous discounts off of over 200 types of medical procedures. Again, I've kind of looked at some of them, right out of the gate. So for example, I looked at pregnancy. It's about a 50% discount off of what the retail rate would be for delivering a baby, by using this program. As well as, you have discounts off of dental care, as well as MRIs, imaging, and laboratory services. And then I think I mentioned the very, very top, if there is a situation where you need to talk to someone about your medical bill, we have an advocate here that can kind of work with you to help negotiate on their behalf, with that provider to help them with their medical bill. So this Well Card program provides incredible value for members to help them, from a cost saving standpoint with a lot of their health related needs. So I think I'm going to turn it over to Mike now, who's going to go over some of the administration behind the program. So Mike, the floor is yours.
Yeah, absolutely. So again, with this program, it's going to be available in 42 states plus Washington, D.C. So there are 8 states that that's their primary residential address that unfortunately they would not be eligible for, and they're listed there right here on the screen. In terms of the application, it's very simple and very seamless. The only things that we need for the enrollment are their first and last name, their primary residential address, phone number, email, date of birth, and lastly, their gender. In terms of the monthly premium, and again, this program runs at $19.99 per month. But in terms of the method of payment, we accept all major forms of credit card, and we can also accept ACH bank drafts directly into their checking or savings account.
So what's the opportunity? So I think I've kind of gone over some stats with you all earlier, but if you think about it at a high level, so again, as I kind of mentioned, there is 58 million people, on a national basis that have some type of mental health issues. And again, you can't flip on the TV and go a couple of days without seeing someone out there with some type of challenges. So it's obviously very prevalent in our society these days. And then obviously, from a pregnancy standpoint, you all are probably very well aware there is so many pregnancies that happen on a annual basis. And to be able to have a concierge to be able to help out that young lady and her family through the pregnancy, I think is such a tremendous resource to be able to have. And you think about it, as Mike just alluded to, this is only $19.95 a month. I'll tell you, you can probably take any one of these 3 pieces and sell it for $19.95 a month alone, and it would be, well worth the value, let alone put all 3 of them together into one rate, whether it be a single or a family. and to be able to provide, all of that into a 1995. And this value, I lowballed it when I said $250. I think it's worth well more than that, but to be very conservative, I made it at a $250 value at the very least. And so, Mike, next slide, please. Actually, we can go to the next one after that, I think, because I think everyone's got a good summary on that. So here's kind of what my call to action to you all is that first and foremost, if you're not appointed with OptiMed already to sell the product, please go ahead and reach out to Mike and his team to get appointed. The next thing I would encourage you all to do is take a look at your book of business. I think the low hanging fruit, are probably young ladies, between 18 and 40, especially if you can kind of hit all three of these pieces in one, that would be kind of low hanging fruit. But then even, from a secondary standpoint would be, other folks that, may not necessarily fit that demographic, but, could be kind of more of a secondary type of solution for them. And then last but not least, you can also use this as a prospecting tool for new clients. It could be a good way to kind of get people interested to buy something doesn't cost too much and be able to kind of get them interested. And then, if need be, you can sell maybe some of your other OptiMed related solutions thereafter. So that would be kind of my call to action to you all. And obviously work with Brenda and Rob and Philip in terms of kind of pulling through on that particular call to action. But that would be my thoughts to you all. And I've noticed that Brad Lacey has also joined the call as well. And Brad was also, he worked with Mike and I in terms of helping build this program. So I kind of want to turn it back over to Brad and let him maybe kind of say some final comments here on his end. So Brad, if you're able to join or able to comment.
Hey, perfect. Hey, thanks, Sean, Mike, and the whole team that represented this. So Brad Lacey, VP of Development for Insurance Specialist Group, worked very closely with Rob Swander and his team. And my background came from United Healthcare on the commercial side, oversaw the ACA component. And what I'm more excited about this product is not only the price point being affordable. It seems like right now, everyone is getting a subsidy, whether that's zero premium all the way up to $5. So what can we do to have a strong product that's affordable, that meets a need? And the need based on internal data at United when I was there, mental health is on the rise. So what can we do to address that? There's a lot of virtual platforms out there, which I think is a great step in the right direction. But at the end of the day, we notice face-to-face is key. And so how do we have that hybrid model? So we're excited about that component to fill that gap. And the maternity. I think the more and more education for new mothers, so along that lines, and being on call 24/7. And then as Sean alluded to, the well card, just the enormous benefits. You use this program once, it's going to pay for itself. And so I'm excited for this. It's exclusive only to OptiMed. So that's the one thing competitive advantage you guys will have in the market. It's exclusive through the OptiMed platform. So with further ado, I just want to thank you. And I see some questions in the chat. So I don't know if we want to address those on that component.
Yeah, there's definitely some great questions in here. And so, gentlemen, if there's nothing else that you want to present, we can go ahead and jump into that. And whoever on the OptiMed team, whoever wants to take each question, just let me know. I'll go ahead and start on the questions, though. We had a really good one at 1:12 p.m. How does one build up to the 5 face-to-face consultations? Is one eligible after so many telehealth consultations?
Great question. So they are not incongruent, like, oh, you have to do the telehealth consultation first before 5 face-to-face. You just have access to 5 face-to-face, or you can use the telehealth consultation. It's a hybrid model component.
Gotcha. Totally makes sense. Thank you. It looks like there's another question. Do we have a list of dentists in the plan? Maybe a link or some way that we can get access to that?
Kind of like the network for the teledentist you're asking? Yeah, we can follow up with you all and follow up with Rob and Brendan and get, maybe not the specific network, but maybe a high level in terms of, how many dentists in certain states and so forth. So I'll take that as a takeaway.
Okay. Thank you. And before we go on to any other questions, I want to mention something real quick. And everybody, if you have any questions, please throw them in the chat. We'll answer them in just a second. But as you're typing those out, we're thinking through those questions. I'll probably go ahead and knock out a couple questions right here. Contracting. If anyone wants to get contracted, which I strongly suggest everybody gets appointed to administer these products, and I'll tell you why. Your competitors will be. I guarantee you, with the robust benefits that these offer, more and more people are looking for these benefits every day. And I can guarantee you your competition, the brokers down the street, are going to be offering these benefits. So we strongly suggest everybody gets appointed with these. I'm going to throw the instructions on how to get contracted, how to get your commission schedules in just a second. So just go open up that chat. I'm going to give you step-by-step instructions on how to do that. It's really simple. You're just going to email me at agentservices@acmgsales.com. Again, I'll throw that in the chat, so don't worry. I'll make sure I throw that in the chat. So be on standby for that. And again, we'll send you your appropriate commission schedule based off of your operation. But as I throw that in there, Sabrina had a good question. Is this only for a group plan or individual?
Great question. Oh, go ahead.
I was gonna say, this is available in the individual and family space, so.
And it is standalone, so it does not have to be with a core product. It can be sold independently as well.
Perfect. So that's a huge benefit right there. If you're doing group business, if you're doing individual business, whether that's private or ACA, this goes across the board there. So I'm actually throwing it in there right now to get contracted. It's putting in here agent services. Make sure I spell this correctly here, agent. Here's why I'm putting this in here. What are you doing to get this available in Wisconsin?
Great question. So we have to, as a TPA, there's a couple of forms that we do have to file, which we have already filed. We are working through the request for additional information currently, so I'm hoping that it will not take very much longer.
Perfect. Someone asked for the one price. Is it $19.95 for family? Can you give us an idea of the pricing for individual spouse, individual children, and family, please?
It is. So it's only one price. So it's $19.95. Whether it's one individual that's signing up for the plan or a family of 5, they'll still also only pay $19.95.
So that's a huge deal right there. If you have, that's amazing for a family that might have 3, 4, 5, 6 kids. It's the same price across the board, which is amazing. Yeah, wow, I agree. Wow. Sabrina asks, are you using the PCHS network?
So this product, it's not a health insurance offering. It's a supplemental plan. So it's not tied to a network in any way, if that makes sense.
Right. They kind of have their own individual networks, right? Like the maternity has their own network of, licensed practitioners. The mental health has their own network. So think of it almost like a telemedicine, right? How they have their own network of providers they use. Kind of the same mentality here.
Perfect. So obviously that's beneficial for the client to have that accessibility of those providers there. Team, I just do it as you please keep asking questions if you have any. I put it in the chat. If you open up the chat and look there, to get your commission schedule and to get appointed, I have it in there. Just email agentservices@acmgsales.com. Go ahead and reach out to us. We'll get you set up there.
Philip, real quick, one thing I want to point out. So we actually just finalized this program late last week. So anybody that's already has an existing agent ID number or profile with OptiMed Health, the product is available on your sales link. If you do not see it on there, please reach out to me and I will get with our operations team. But kind of going back to what you mentioned about contracting. So this program is exclusive to OptiMed. And I also want to point out that this is our very first training webinar that we've had on this product. So you guys are the very first core group of people to receive any information on it, essentially.
Oh, there we go. So everyone in here, you have the kind of the leg up before this starts spreading very, very, very quickly. And that's also great to know, Mike. Thank you for sharing that. That's a big deal to be able, if you're currently contracted with OptiMed, just check your agent portal for that link. And if it's not on there, just email the agent services at acmvsales.com and we'll make sure we get that implemented onto your agent portal. So we'll make sure we get you set up. If you're not contracted with OptiMed in general, you definitely want to do that. We can talk, we have other presentations on our YouTube channel that you can go and look at, but this is just a piece of the pie of the value that OptiMed offers as a company. There's a lot of amazing products available. So definitely want to get contracted. I'm not seeing any other questions in here. So gentlemen, before we wrap up this meeting today, any final thoughts?
Just from my end, I would say, Mike said it very, very well at the top, and Brad summarized as well. First of all, we really appreciate your all support and partnership with Rob and Brenda and the rest of everybody else on the phone. It's very important to us, and we really appreciate that. And again, that's part of the reason why we want to come to you all first with this versus maybe going to some other folks. So we're very excited about seeing how this goes with you guys.
Awesome. Well, thank you for sharing that, everybody. If you want this meeting was recorded, you can go to our YouTube channel, American Central Marketing Group, and you can look at this training if you'd like the recording or send it to somebody, as well as all of our other presentations. Everybody, thank you so much again for being with us today. It was an honor to have you. Reach out to us now if you want to get contracted. We'll set you up. Besides that, gentlemen, thank you for a great presentation. Everybody else, we will see you next time. Have a successful week.
Thanks, Philip.
Thanks, everyone.